So let's look at the genital system, starting with the male genitalia. So we want to be able to identify the different aspects of the male genitalia, both the internal aspects, and we want to see. I believe by now we already know their blood supply, such as the pudenda, femoral, and all that. So what we want to look at is the morphology of the individual structures. So I believe you must have heard of the word testis. You must have seen this somewhere else. Testis, testicles, and testicles. S. So this without S, this with S. So what would be the difference?
One versus two.
So what we have here with this, and by the time we put both of them together, then we are going to get this. So if we make our skin incision and bring out the balls, then we will have one of these and two of them testicles. And this, a lot of reputable literature mix them up. They are not the same thing. Any confusion? Okay. So the anatomical location of the testicles varies across different locations, some anal, some inguinal, and some perineal. I'm not going to
Oh.
yeah. So what is a castrated male cat called?
A cat.
A cat?
Yeah.
Because a tom is not castrated.
A gib. A gib.
Mm-hmm.
No one uses that.
No, it's called cat.
This is more common in places like Europe and the UK, but in the United States, what mostly hear of is new child cat.
Yes.
New child cat. For this one, UK and the Europe, this is what's yeah. So this is a testicle of the cat showing the epidermis, and here we have inguinal location located, and this is perineal, and this is inguinal. The testicles develop intra-abdominal. It comes all the way from the abdomen. But it doesn't remain there. In animals like bats, elephants, these testicles remain within the intra-abdominal space. Which other animal?
Chicken.
Yeah.
Reptiles.
Yeah. So we have other marine mammals like dolphins and whales. They have their testicles within. So why do we have testicles in domestic mammals outside? stated that in domestic mammals, the testicles needed at least 5 degrees Celsius lower than the body temperature to function. So that is why it is situated outside the body, and we have heard of structures such as the cremaster muscle, and these pull the testicles towards the body for warmth and relax, to pull the testicles away from the body for cold. And this is called thermoregulation, and it is necessary for protection on a normal function of the testicles. So generally, the testicles, so let's say this is the abdominal cavity, and we have the empty scrotum here, and this is the abdominal cavity. So let's see if I have any picture here. No picture here. So these comes all the way from they have the same anatomical location with the kidneys. They come from the same location with the kidneys. So we have this structure called gubernaculum. So this gubernaculum is a structure, is an embryonic structure that attaches these testicles to the scrotum. So this gubernaculum shortens with time. It shortens with time as the animal develop, continue to grow. And this inguinal canal here also continue to shrink. So a timely arrival of the testicles into the scrotum is required. Timely arrival of the testicles into the scrotum is required before the shrinkage of the inguinal canal. So if the testicles fails to descend into the scrotum, if there is a delay in the arrival of the testicles into the scrotum, then it becomes retained within the abdominal cavity, and this leads to the condition called cryptorchidism. So this, under normal condition, the gubernaculum continues to shorten until it pulls the testicles into the scrotum, and then it forms what we call the scrotal ligament that helps to attach the testicles to the inner lining of the scrotum. So this condition could be unilateral or bilateral. So here is a retained testicles within the abdomen. You see this one here has descended, and this one yet to descend. So what would you do in clinic in this case?
Surgery.
Go get it.
Go get it.
So have you done reproductive physiology? No, histology.
Histology,
Histology,
yes.
yes.
Okay.
I did last semester.
So then we shouldn't waste time here. So this this is also talking about the histological aspect of the testicles, and the same thing here as well. So last semester we have seen how these muscles form the vaginal process, and we have also seen the cremaster muscle that helps to attach that connects to the testicles and pull the testicles upwards. So we have deep and superficial inguinal canal. Do we still remember what form those structures? Superficial inguinal canal, external abdominal. Superficial inguinal canal, external abdominal oblique muscle. Deep inguinal canal is internal abdominal oblique and transverse abdominis. So the cremaster muscle is an extension of the internal abdominal oblique. The penis, the male copulatory organ, is classified into two. So we have the vascular and we have the fibroelastic type. So the vascular type here, what we have here is erectile tissues. So it has numerous erectile tissues. It has numerous erectile tissues in between here. So these are erectile tissues. And these are connective tissues. These are connective tissues. The connective tissues are few. So multiple erectile tissue mean that this penis is capable of increasing in length and diameter, during erection. So these erectile tissues are what we refer to as the cavernous muscle. The cavernous muscle. The fibroelastic type of penis, this erectile tissue that we have seen here is what we have occupying almost every, connective tissues. These connective tissues that we have here is what we can see here. So this means here we have numerous connective tissues and few erectile tissues. Erectile tissue here is few. Erectile tissue here is few. So what this means is that this penis will not be able to increase in diameter. So the increase in length that we see here is not due to the action of the erectile tissue, but what we call sigmoid flexion. Sigmoid. So it increased in length, but not in diameter, and this is due to sigmoid flexure. So we have a fibroelastic type of penis in boa and ruminants. So this is a cross section of the structures that we have talked about, the cavernous and the connective tissue here, and also the cavernous muscle here as well. So those that have the vascular type of penis, of course, the dog, cat, and horse. And one of the primary structure in the dog is the os penis. Os penis. Do we have this in cats also? Os penis. I think we do. Os penis. So if you see a radiograph of a cat and you see a bony structure there, you don't need to perform surgery to remove it. Yeah. They have bony structure within the soft tissue or visceral tissue. So this is what we call splanchnic bone from our classification of different types of bones. So one of the characteristics of the penis in the cat is this presence of spikes. So it has spikes. So what is the effect of these spikes? Or what is the function of these spikes?
Lock into the female.
It does what?
Lock. The male locks himself onto the female.
That would be bulbo glandis. Yeah, that would be bulbo glandis in the in dogs. So these what do you call female cats, queen?
Mm-hmm.
So they naturally don't go into ovulation except when induced, and these spikes are the structures that induce ovulation in female cats. So these spikes are seen on the glans penis. Seen on the glans penis. So you can see the penis of a stallion, erect versus non-erect. So you can see when erect, this is somewhere around, what joint would this be?
Hawk.
Okay, around the hub. So we will say that is extremely long, and this is flaccid when non-erect. So this is the prepuce. So it has gone into the prepuce. So this has the glans penis here. Maybe we should get a better picture that shows what the head looks like. Some anatomy literature call it mushroom, like a mushroom-like. Mushroom-like urethral process. It has a mushroom-like urethral process. Has a mushroom-like urethral process. So, what is this urethral process? If we look at the penis of the, we'll go and come back again. So this is a continuation of the urethra, extending through the length of the penis to the exterior. So this is a spiral shaped glans penis in box. Spiral shaped glans penis. In the in bull, we will say that the penis is rounded. And also it has an elongated glans penis. So this is the penis of a goat and a ram. So these are urethral process. You see here that urethral process here is longer in ram and shorter in goats. So how many types of urethra do we have? So that's part of the urethra that detaches from the bladder extending within the pelvic cavity is called the pelvic urethra, and as soon as it gets into the penis, then it becomes the penile urethra. So let's see if we can talk about bulbal glandis. See if there's any picture here that we can use. Yeah, so this is bulbal glandis. So what is bulbal glandis? What is it? Yeah, you say that it locks the penis. The function is to lock the penis inside the female vagina. So why is that so? Why is that necessary? Naturally, dogs are animals that they are quick about mating, and without this bulbal glandis, reproduction would be could be difficult actually, because the bulbal glandis, what it does is that it increases in size, and the female vagina also constricts these bulbal glandis, and constricts just caudal to the caudal to these bulbal glandis, and the essence of this is to prevent the withdrawal of the penis before ejaculation. So these bulbal glandis increases in size, locking and thereby locking itself within the female vagina, and it only becomes flaccid after ejaculation has occurred. Do we have this in cats? No.
Is dog the only species that has
Yeah.
it, like, ever?
Yeah.
Of all time?
Yeah.
That's weird.
Cats, have you ever seen, how often do you see cats mating?
Never.
Often if you have a big cat
Yeah.
colony.
So mating, cats consider mating as a more secret affair than humans. So should I say they pay more attention to it than dogs, and dogs just want to be quick about it.
No
But,
hump anything.
yeah, the cats. Before you can see a cat mating, you have to get a torchlight and looking at holes in the dark before you can see them somewhere else mating. So they consider it as a secret affair. So in most cases it's dark and somewhere very, very secretive, so they consider it as a secret affair, and they take their time to do it without anything interrupting the ejaculation. But dogs, anywhere on the streets, they just want to mate and be quick about it. But so that is why they have these bulbs like this.
It's just weird that like they evolved that way. Like
Yeah.
like evolutionarily, why? Like it's just bizarre.
It has to do with their mating behavior.
I know, but like
Yeah.
why?
Yeah, so the importance, the reason why they need that.
No, I know why they need it. I'm just
yeah.
saying like, why did they like ever get to a point where they needed it? Like in the evolutionary process.
Yeah,
It's
maybe.
just bizarre. It's bizarre to me that they took that weird branch that no one else took.
Yeah, maybe this their mating behavior and their system say, we have to do something about it. So.
I have a lot of questions for the universe.
Yeah. So, during our dissection, we could make an incision on the penis to see if we can be able to identify some of these muscles of the penis. And,
None of us have male cadavers.
We do.
You do?
Yeah.
Oh, okay.
Yeah.
I thought we had females. Cool.
We have the one now.
That was fun.
One will do. So we have so this is what we refer to as the Volvo glandis, cavernous body and the spongy body. So this has a lot of like trabecular spaces within the spongy body. This is found ventral, and the cavernous, which is more muscular, is found dorsal in the dog, and you can see that is somewhat reversed in the case of the cat. So here we have the pelvic urethra coming all the way. We have the pelvic urethra, so short here, and as soon as this gets into the penis, it is called the penile urethra.
Wait,
So,
you said it's opposite in cats?
yeah.
Okay.
So yeah, I was in Aka's office and I saw he was writing something about bilirubin on the board, and yeah, so he was saying hepatic, post-hepatic.
He was talking about nephritis and kidney urinary stones.
Okay.
Kidney stones.
He
Because
talked
of
about it.
yeah, he talked about hemolysis that leads to something that causes nephritis, that leads to protein leaking through the barrier into the kidney, which causes stones, something like that.
Yeah, so yeah, we're having that discussion. Was it last week or this week? Yeah.
I spent 6 hours last night reading renal physiology, so
Okay.
those were
When did you have the lecture with him?
last.
All, last week.
Quiz over renal tomorrow.
But that's all I can recall, but I did spend a shitload of time last night going over renal, so.
So I was with him, so I was we were chatting about it, and so I saw the delivery where he was talking about the pre-hepatic, post-hepatic, and hepatic, and I was telling him how it's similar to hematuria, and was just thinking about the anatomical aspect of it. So there are 3 different places that hematuria can occur, and or should I say, that is the causes can be from either the kidney, the urinary bladder, or the penile urethra. So how can you tell the cause of this blood. So hematuria, of course, blood in the urine. So, how will you be able to speculate to tell where the cause of this blood in the urine could be? Usually we have a stone, kidney stone. So sometimes administration of drugs such as excessive use of drugs like sulfur drugs and can also bring about these kidney stones formation. So it could form anywhere, whether in the bladder or within the kidney, somewhere here, and also here. So if it is here, what you see is bloody urination. From the beginning to the end of the urine is blood. So the dog begins to pass urine from the beginning to the end of the urination. Everything is bloody. So if it is here, what you will see is the beginning of the urine. The beginning of the urine is free of blood, and the last drop of it comes with blood, and that tells you that you most likely have this stone within the bladder, because when the bladder compresses at that time where you have this stone coming in contact with the wall of the internal lining of the bladder, then this traumatizes it and allow blood to flow with the last drop of the urine. And if you have this stone within the penile urethra, what you see is blood, hematuria at the beginning of the urine, and subsequent urine free of blood. So these are different types of hematuria. So the sigmoid flexure here, this is what is responsible for the erection of the penis in the hole and the pore, and this is described as S-shaped. It is S-shaped. So the bull and the pore differ in terms of their sigmoid flexure. One comes before the testicle, one comes after the testicle. So this is called prescrotal, and this is called postscrotal. So what we would like to look at here is the accessory sex glands, and here we can have a table that tells us basically we'll be looking at what is absent here and what is present here across different species of animal, and these anatomical location of these accessory sex glands is within the pelvic portion of the urethra. They are located around the pelvic portion of the urethra. So there are about 4 different glands, and these vary in different species of animals. So here we have the ampulla, the ampullary gland, and here we have the vesicular gland, and here we have the prostate gland, and we also have the So these vesicular gland here in this animal bovine, this is palpable structure, can be palpated transrectally in bull. So the prostate is a very important structure, and we have what we call the disseminate parts and the compact parts. So it has two different parts. These different parts are found in the large ruminants. It has two parts that are present in large ruminants, but in small ruminants, only the disseminate parts. So it's called disseminates. Disseminate parts.
What was the second part called that you said?
Compacts. So large ruminant has both, small ruminant has just the disseminate part. So the compact part is usually the lateral portion, and the disseminate part is the internal portion. These are bulbourethral gland. They are small and cherry shaped.
Sorry, you said the disseminates internal and the compact's external? Is that what you said?
Lateral.
Lateral or external.
Internal and lateral?
Lateral, external, we are talking about the same thing. So
No,
kind of looks like something like this. So we have the, let's see if we have, so here we have these lateral parts. So not well defined here, lateral parts. So let's call these the compacts. And the center here are the disseminate parts. So what is the importance of these glands?
Semen nutrition.
Semen nutrition. What is semen?
Semen is just the fluid.
Sperm nutrition.
You can have semen without fluid, without sperm in it.
So what is sperm?
The sex cell,
Huh?
the male sex cell, right, like the.
Mature.
Sometimes I don't like using the word sperm. I prefer to call it ejaculate. Sperm is the same thing as ejaculate, the same thing as semen. We are still saying the same thing. But by the time you say spermatozoa,
So what would you call the fluid with no sperm in it then? If it's absent of sperm, what would you call that fluid?
it is ejaculate. It is a sperm. It is
But
a
there's-
semen.
Right, but you
Yeah.
can't use the word sperm and say that it's the same thing as semen if one of them
So
could be
you
liquid.
have to perform microscopy before you give it a name.
Well, you have to have a way to differentiate, like a terminology that differentiates the two. If you have two
It
fluids,
is-
one's got sperm,
Is
one
it,
doesn't.
in the first place, is it possible to have zero spermatozoa in a semen or ejaculate?
I don't know if they're,
Zero ejaculate?
yeah, vasectomies, or if you're,
That is a different.
Well, if you're-
but that normal
if you're,
procedure.
well, if you're
If
they're
born
born
technically
yeah, if
infertile.
if it's
they're-
born sterile,
Yeah, so there'd be no sperm,
Yeah.
there'd be no mature
if it has
sperm.
like some kind of genetic defect where it's
Yeah.
born
So
sterile.
it's not all infertile animals that have zero spermatozoa.
There's gotta be
So
something.
can urine be called ejaculate since it comes out of the penis?
No, it is being produced. When we say ejaculate, we are talking about it is a product of both the testicles and the accessory sex gland. That is what we call ejaculate, semen. The essence of this as semen, the spermatozoa cannot survive without the semen. So the semen is there, it's like a vehicle for the spermatozoa.
But what if like, someone wants their dog to just get a vasectomy so it keeps its, testicles and still looks manly?
So do what?
You
So
know,
you like, you tie
people,
the
people,
dogs to it.
there's a lot of people that don't like their dogs not having balls, because it makes the dog look girlish or something.
Okay.
So they want to keep the balls, but they don't want them to be,
Yeah.
fertile.
Okay.
So they will.
They'll pay. It's
Yeah,
happening.
they'll pay a shitload of money for them to,
Just tie them.
yeah, well, the vas deferens, they
Yeah.
ligate it, but they still have the testicles.
Okay.
So they're still able to produce ejaculate, there just would be no sperm in it.
So at what point, at what point did they produce ejaculate?
I don't know, I'm asking you. I'm saying it's possible, and what would you call it? There has to be a way to differentiate the two types of fluid, one with and one without. I'm gonna look into it for you.
Okay.
I'm gonna send you an article on ejaculate versus
You
semen.
can read it on the plane.
Yeah, it can be your light reading for your plane.
I'm pretty sure that there is no different name between whether you have spermatozoa or no spermatozoa. I'm pretty sure I had a very good.
There
knowledge
1000% is a difference in humans.
Oh, really?
Yeah,
Huh.
my partner has had a vasectomy, so I know there's a different name for it, for the two.
So what is the name without spermatozoa?
Semen,
So if you have spermatozoa in it,
or ejaculate, I guess.
so if you have spermatozoa in it, what do you call it?
Sperm.
No.
Well, the sperm is the cell.
In science, we scarcely use the word sperm. We either use semen or ejaculate. We
Okay,
don't
okay,
have-
so with
those are
that,
the only two
so-
words that we have there in
So it-
existence as far as
so
science is
ejaculate
concerned.
would be what you would call,
So ejaculate, whether you have spermatozoa or not, is still ejaculate.
right,
whether
but you
don't
can't,
have-
but you can't call ejaculate without sperm semen.
Yes, we can.
I'm gonna send you
It's
some,
not reproductively viable.
yeah, it's not reproductive, yeah, I'm gonna send you some articles, don't worry about it.
Okay, thank you. I would love to see it. We were having a lab, and we needed a urine.
I found it.
Okay, tell me.
Azoospermia, AZOO,
That is a pathology.
is the medical term used when there is no sperm in the ejaculate.
Yeah, that is a pathology. We are saying
But
that's
it
why
has a
it's-
name.
yeah. But that is a.
No, that's the
that is
condition.
not-
He's
yeah,
talking
that's
about-
a condition.
He's talking about the name of the fluid.
Yeah.
I'm gonna find you a peer reviewed journal, okay? I got it covered,
Okay,
don't worry
let's
about it.
see. I'm eager to know it.
There has to be a different name for, you can't call one thing the other, okay, continue.
So we have, we were having this, lab, practical, and we needed urine, to look at microscope, under microscope, to do some kind of analysis and all that. And, the lab technician said, somebody needs to volunteer. So, and, one of our colleagues, they gave him bottle, and he went out and he urinated. And, when he brought the urine, and we're looking at the urine, the, microscope, and we saw sperm cells flying within the urine. We say, hey, what's happening here? So, what do you think would have happened?
We oftentimes see sperm in, like free catch samples. from male dogs.
So,
On-
The
underneath.
valve closed.
the
It-
what?
It's like the leftovers.
Yeah, from the night before.
Yeah.
Okay, so we were kind of suspecting him that he had, an affair last night.
An affair.
Yeah.
He had relations.
Yeah. So, but if, so what if that is not the case?
Oh, going to be an issue. with
Have
the-
you heard of
the valve
retro,
closure.
have you heard of retro ejaculation? Where the semen or the ejaculate is supposed to come out through the penile urethra or go back to the ejaculation is going back into the bladder and not to the exterior. That is what we call retro ejaculation. So when you urinate, you see the sperm cells within the retro ejaculation.
Is that common?
Yeah, it's common, very, very